Welcome all, and thank you again for tuning in to this week's industry update webinar. I would remind you that the webinar is designed for the use of our restaurant, hotel, travel and tourism, and other allied and friends of PRLA. It's off the record. It's not designed as a press call. If you're with the press and need to talk to us, feel free to reach out. We entertain any and all inquiries, but if you're with the press right now, please disconnect. And I join Hope and Melissa in thanking Megan Abbott, who's the Director of Intergovernmental Affairs with the Department of Health, for joining us today. And with that, I'll turn it over to Melissa to kick things off. Melissa, thank you.
Of course, thanks, John. As John mentioned, for right now, let's keep it that way. Things have gotten a little quieter in terms of my weekly updates. So as opposed to spending a full hour of you hearing from me, we've decided to start bringing on some guests to kind of update you about what's going on in various state departments, city departments, things like that. And Megan, who has been on a few calls with me, was gracious enough, or just not thinking it through, but she accepted the opportunity to be here today. As John mentioned, she's the Director of Intergovernmental Affairs at the Department of Health. Primarily, we asked Megan to provide an update on where we are with vaccines. I'll preface her comments that I know the department is in a bit of a state of transition, which is very exciting on all fronts. But Megan's going to kind of provide things that she knows. We'll, of course, be asking the general topics that we usually do. If you have questions for Megan, please put them in the chat box while she's speaking. We're going to save her from having to stay on for the full hour. So stay muted, put your questions in the chat box. Megan, I'll read them to you as they come up, and we'll get you off before 11:30. So thank you so much for being here. And with that, Megan, take it away and give us every bit of good news you possibly have.
Sure. Thank you. Thank you for having me. It's been, a real pleasure for me to get to know the different industry types and different organizations who the Department of Health maybe otherwise wouldn't have gotten to know if it wasn't for COVID. So maybe a very small silver lining there. I know it's been really difficult for all of you, and I just want to say on my behalf, but I'm really appreciative of your efforts and your sacrifices and the work that you've done to help keep us all safe. We're really appreciative of that. So I am the Director of Intergovernmental Affairs here at the Department of Health. I do external engagement, stakeholder outreach. I've got, get to know Melissa and the team with the association. So it's that's what my role is. My background is largely in nonprofit work, and so I was a stakeholder. Now I get to work with them, so I know how difficult it is for organizations, different people, much like yourself, who don't have access to the government or to a person to ask questions to. And I think I've tried really hard as much as possible to be an open door and to be able to try and help provide answers for people. I know it's quite difficult. So I did see a question pop up in the chat. I do have a master's in social work. That's what the MSW stands for. So I think to start, I would, you all are keenly aware that we are still in the middle of a pandemic. We have seen our cases plateau a bit. We're looking at about 4,000 to 5,000 cases a day, which is lower than before, but not the lowest that we've seen. We're feeling very encouraged by those numbers. However, skeptical about some of the new variants that we've been seeing and learning about from the UK and other places. So we're being very cautious about those strains of the coronavirus that are more than likely here in Pennsylvania. What everyone really wants to know about is vaccine. Our vaccine rollout started about, 6 weeks ago, maybe. And we have been receiving our vaccine allotments from the federal government. So previously it was through Operation Warp Speed, and now it is through, the Biden administration has changed the name to the Operation. So vaccine allotments come from from the federal government. To support that work, Pennsylvania, much like every other state, we did put together a vaccine plan. It's very lengthy. I'll try and multitask best possible. If not, I'll drop it in the chat after. But our vaccine plan is posted on our website. We are currently on a version 5. The plan is an interim plan. We are doing our best to be nimble and responsive to the recommendations from the federal government and following the science to the best of our ability. The plan is 60 pages long, so well done if you have read the whole thing. But most of the meat that everyone really is looking for, I believe, is on pages like 14, 15, 16. That's where the phases are. So maybe that's where we can go next is, as you've all seen and heard, there are 2 phases broken down in a couple ways. So right now we are in phase 1A. That includes those in long-term care facilities. It also includes healthcare workers. Several weeks ago, Secretary Azar, when he was still in office, recommended that all states begin to vaccinate those who are over 65 or have certain medical conditions. So we did make that announcement and we did make that shift. As you know, that opens the door to many, many, many more Pennsylvanians. We have, I think we estimate somewhere between 3 and 4.5, 5 million people that fall into that phase 1A with the expansion. So it's quite a few people with the addition of those, age bracket and certain medical conditions. Further, we have phases 1B and 1C that encompass people in critical work forces, much like yourselves. Phase 1B and C also encompass those who may have fallen slightly outside of phase 1A, certain congregate settings and things like that. After that, we have phase 2, which encompasses even more people. And then finally, really just general public, anyone who's able to get a vaccine. Something I do want to talk about, just to sort of level set a little bit, is the difficulty of the 2 products that we're dealing with. The Pfizer vaccine must be kept at super cold temperatures, so that's -80. And the Moderna vaccine is slightly warmer, I guess, is kept frozen. So those who deal with immunizations all the time are used to handling that type of product. So we are, trying to ensure that those who can handle the Pfizer vaccine are receiving that product because it is more difficult to work with. So we've briefly talked about the plan and about the phases. I think that the next thing to talk about is really the pathways that those who are eligible to receive vaccine will be able to. I think the first pathway is in support of our long-term care facilities. We've learned, that this population is incredibly vulnerable. We've seen significant loss of life in our long-term care facilities throughout the pandemic, and making sure that those who are in nursing homes and long-term care facilities get vaccinated is, really of paramount importance for the department. In order to help do this, we, along with 49 other states, have joined the Federal Pharmacy Partnership. That is with CVS and Walgreens. Their facilities are partnered with a pharmacy partner, and they go into facilities and vaccinate on site. So CVS will be partnered with a skilled nursing facility, and then the CVS folks go to that facility and vaccinate those on site. They will do, I believe it's up to 3 clinics per facility, and then they also go back for second doses. So it's not, it's not just a first dose situation, they go back to make sure. So that's, our Federal Pharmacy Partnership, that encompasses skilled nursing facilities that we regulate here at the Department of Health, but also includes some personal care and assisted living facilities, which are regulated by the Department of Human Services. If you are familiar with DHS and the Department of Human Services, they have many, many more facilities than just their long-term care facilities. They have a really wide breadth of different facility types. And they have further partnered with Rite Aid to help get those facility types vaccinated. They announced it, I believe, last week, 2 weeks ago. I can try and find the press release and put it in the chat box, or send it to Melissa after. that those DHS facilities are going to be working with Rite Aid to make sure that those congregate care settings are vaccinated. Another pathway to receive the vaccine is through our federal retail pharmacy partnership. There we are working with Topco pharmacies and Rite Aid. So we're all familiar with Rite Aid, most of us have them in our neighborhood, but Topco pharmacies is a family of pharmacies that are part of mostly grocery store chains. So if you're from the Southeast, I believe Topco pharmacies are in Acme's, here in Central PA, Wegmans or Wise Market, and then in the eastern part of the state, Giant Eagle includes Topco pharmacies. So that's not, all of Topco, but that's just an example of the type of store that they're in. Given our limited amount of vaccine, we're not able to send product to every Rite Aid or every Topco pharmacy at this time, but our hope is to really get there. We did start by sending vaccine to specific stores that help us meet some of our equity goals, and then we'll keep expanding from there. Another pathway to receive the vaccine is what you've been hearing about is our other enrolled provider types. So that would include hospitals and health systems, other pharmacies who are not maybe one of the pharmacy chains I've already mentioned, our federally qualified health systems, and other provider types that are eligible to receive the vaccine. So those folks have been receiving and then making appointments or coordinating within their communities as they see fit. I think something that's important to talk about is what and how you become a provider. So becoming a vaccine provider is a heavy lift for some. Like I said, the managing and handling the vaccine is difficult, particularly as the Pfizer product. The Moderna product is easier for those who might be a family physician's office or something along those lines to receive the vaccine. So our provider enrollment process is still open. Other states, and I also believe Philadelphia's provider enrollment opportunities did close. Ours is currently still open, so those who are pharmacies, family physicians, or others are able to still enroll to become a provider. That doesn't mean that you will begin to receive vaccine right away. We do have a really limited quantity. So that's the pathway to become a provider. There are many different boxes you have to check to become a provider, including appropriate storage and handling of the vaccine, the appropriate person to give the shots, and also we have really robust data reporting requirements here at the department. That way we can let all of you know how many vaccines we've given and what dose each person has received. I think I also, want to talk a little bit about yet another pathway to receive vaccine will be targeted vaccination sites, community vaccination sites, mass vaccination sites. That's something that we're working on with our colleagues at PEMA. So that's actually where I am. I work out of our command center at the Emergency Management Agency, and we're working with our colleagues here to stand up vaccination sites based on the amount of vaccine that we have. So given the small amount of vaccine that we have, we're not able to stand up, really large arena-style mass vaccination sites that I think many people think of, at this time. I think we'll get there, but we're not prepared to do that now. We are currently working with them to stand up targeted vaccination sites in counties that might not have good vaccine provider coverage. So that's where we're starting, and then we'll expand and grow from there. So I think that's something that maybe in a couple of weeks I'll be able to come back and tell you more about is those opportunities. But right now, that's a space for us to grow. Further, we are working on creating something similar to the business-to-business portal that was created by the Department of Community and Economic Development with PPE at the beginning of the pandemic, is trying to figure out the best way for us here at the Commonwealth to connect employers with those who are able to provide vaccines, much in the way that you might receive a flu shot at your workplace. So that also is in the more to come column. We're working on the way to execute that in a really appropriate way, and making sure that those who are appropriate vendors or providers are able to receive enough vaccine to help support communities or employers who they might work with. So we do have limited vaccine. We're not quite there yet, but I think that's someplace where we'll be moving, and I'm pleased to share when we have some more information. I do keep mentioning how few vaccine we have or how little vaccine we have. Our team gets our full allocation each week, and then they go through and ensure that providers are receiving their second doses. And then on top of that, we have what's left for available first doses. And each week, the past 2 weeks, it's been about 140,000 doses of vaccine. And if you are a Penn State fan, that really is Beaver Stadium plus the parking lot. Like, it's a very small amount of vaccine to send to 66 counties. This is a good time, I should have mentioned it earlier, is that Philadelphia is its own vaccine jurisdiction. They have their own vaccine plan, their own immunizations program, and they receive their own funding. It's not unusual for cities that are really large inside states to have their own vaccine jurisdiction. So Philadelphia County is served by the Philadelphia Health Department and their immunization program. All 66 other counties are served by us here at the department. And we allocate vaccine to providers across the Commonwealth in that way. I think that's a good place to stop. I could probably go on, but I want to leave some time to make sure I address as many questions as I can.
No, absolutely, Megan, that's really helpful. The first question is not really a vaccine question, so we'll throw it out there and see if you know the answer, and if not, we can look into it. Are there any state guidelines that manufacturers need to follow if they want to give their employees the rapid antigen tests? Is it acceptable for CROTA to administer the rapid antigen test for employees who want to be more quickly tested? And are there any restrictions or requirements for employers to give tests to themselves in Pennsylvania?
So yes, the short answer is yes, there are requirements. COVID-19 is a reportable condition here in Pennsylvania. So that means that electronic lab reporting or test results need to come back to us here at the Department of Health. There is a section on our website, which I know we've reorganized the website a little bit and it might be hard to find. So I'll try and send the link, or Melissa, you can remind me later and I'll send it to you, is the antigen test section on our website. It does give a fact sheet and some info on how they work, kind of the science behind them, but also there's information on how to provide, how to report, and some of those other pieces. We put that out as part of our Pennsylvania Health Alert Network, which are more clinical based, but do include things like how the antigen tests need to be reported and the best way to use them, symptomatic, asymptomatic. There are several parameters around them depending on the test as well. So I'll see if I can find that, and if not, Melissa, just remind me.
Will do, thank you. Where do restaurant workers fall within the vaccine distribution schedule?
So I do have pulled up on my screen, and I will drop it in the chat right now, is a really helpful document from the CDC. It's a chart. So when you get it, scroll down past the first kind of section of text. There are some charts that do break down. The CDC did do some mapping of critical industries and the vaccine phase that they fall into. And it will help you, sort of figure out what phase folks fall into. I believe food service and travel accommodations and most of the industries that you all fall into would be in 1C. But please take a look, and if you have further questions, you can let Melissa know and I can answer them. Okay, let me drop that.
Yeah, I think Megan answered the second question, hotel team members. So it does look like, and Megan mentioned this to me in the past, Pennsylvania is strictly following the CDC guidelines. So we need the CDC to really bump us up to 1B if we want to be bumped up to 1B, because currently we're in 1C. Could
yes,
you provide maybe a little bit of color?
Oh, go ahead. Go ahead.
I was just going to say, I know that we're kind of entering 1B, but not really 1B. So do you have an update? I know you mentioned there's not a lot of vaccinations available right now. Do you have any idea as to when PA will kind of more fully enter phase 1B in terms of encapsulating all the facets of 1B?
I don't know. I don't want to tell you something that's not true. I don't know the answer on when we will go to 1B. I think if you are a person who meets any health conditions or falls into the age bracket that would put you in 1A, absolutely do your best to get vaccinated. I know it's hard. It will get better. We're really hopeful that each day the Biden administration puts out more information, and it appears that we should be getting more vaccine. We're still learning along with a lot of you with further information. So I don't know when we will go to 1B. I do believe that we will not fully complete 1A. We know it's really difficult, and at some point we will likely turn to where we have, right now we're seeing exceptional demand and limited supply. I think, we're very hopeful we'll get to a place where we have more supply, but then we'll be tackling vaccine hesitancy and working through, making sure people feel safe and comfortable taking the vaccine when we get to that point.
Okay.
So before we move on, I think,
up.
Melissa, the question about Philadelphia and food workers being in 1B and the Commonwealth being in 1C, that's where it comes into account that we have two separate vaccine jurisdictions. So Philly can make their own plans and their own decisions, but us as a Commonwealth with all 66 other counties are following the CDC's recommendations. That's not to say that if the CDC recommendations were to change, I think we would also evaluate and take a look, work with our clinical experts to see how that would affect our plan too. But for now, food workers and hotel employees, from our perspective, would fall into 1C along with that chart from the CDC.
Yeah, to Megan's point, Philadelphia is a special land that's always different from the rest of the state. So that's what you have to keep in mind. Next question, then I'll jump back to the one that I asked you before that I know you don't know the answer to, but we have to ask it anyway.
Yep.
You had mentioned the small amount of vaccines PA has received. Were the allocations not based on population? And if so, how is it that states like West Virginia have seemingly been more effective in getting the vaccine administered to its citizens?
Sure. So I think that here, we are looking at many different factors to determine what providers will receive vaccines. So we're looking at both population, throughput, how quickly providers are able to vaccinate folks. We really want to be making sure we're looking at things with an equity lens. Here at the department, we have an entire office of health equity who's helped us do some of that work already. And we really, want to make sure that we are expanding our equity perspective, that we're not just vaccinating, that we're really reaching deep into communities. West Virginia is a little bit different than Pennsylvania. They did not enter into the federal pharmacy partnership for their long-term care. They've taken a bit of a different pathway than we have. I think from my perspective as a former, nonprofit sort of community-based person, I think our pharmacy pathway is really helpful for folks. I know my mom is a pharmacy tech actually, and she got vaccinated, and she was very concerned with where she went and where she parked and how it worked. And for those of us who visit a pharmacy almost weekly, you're really comfortable with those people. Them, they're in your community. So many people haven't been in a hospital since their children were born. So going to a hospital can be really intimidating. As wonderful as our health systems are, I think our pharmacy and community partnerships are really valuable. So we're doing our best. I think something that's really important for you all to take a look at once it's up is we're working on making our map on our website with provider and provider information more robust, more real-time data. That's something we're trying to get stood up, I think, by the end of the week to really make it more robust. Same with our vaccine dashboard that's on our website. I just came from a conversation on how we can improve the vaccine dashboard and provide more information to help folks understand that we are pushing vaccine to providers and also operating on a 2-dose strategy. So it's really important for us. Our clinical folks really believe that a second dose is critically important when other states have not necessarily accounted in the same way that we have for a second dose.
Okay, I'm going to go back, and this is going to be on behalf of some of our event venues and things like that. With the current COVID mitigation, especially with kind of outdoor gatherings or even indoor currently, obviously indoor gatherings, if they're not restaurant serving the public, it's 10%. Do you expect the COVID mitigation measures to last beyond April 1st? Should the wedding industry make preparations to work outside this spring? How's that crystal
I
ball
knew you had
today?
to ask that question, of course. So I don't know. I think we are looking at the seemingly plateauing cases while trying to balance the risk of the new variants. I don't want to give a timeline. I just don't want, I think operating on a really firm timeline is difficult, but I have heard, excellent feedback from all of you and from Melissa that is something that you all need, that it's helpful for your planning. Turning things off and on so quickly is really difficult for you. So I think, taking that into consideration and understanding that the weather will be getting warmer here before we know it, and that's really important to your industry. So I don't have a specific answer, but I can tell you that we're talking about it, and that Melissa and the team are obviously incredible advocates and doing absolutely everything they can to help the industry and influence, to guide the decision making that's most helpful for you all.
We're talking to everyone. If we have to talk to like the trash man, we'll talk to the trash man. I mean, Megan's been hearing from us a lot. Last
That's how you get
question,
it
and then
done.
we're right. Yep. How do those over age 65 get a vaccine? Do they just go to a provider, or is there a website to sign up for an appointment? And that's probably kind of more of a universal question, because I know there's been some questions on websites you can sign up and you're supposed to get a call, but then you could also call a provider. So what's the best way for people to go about if they're eligible to get the vaccine?
So the map on our website is a great resource. I just mentioned it will be updated. We're working on making it better. So I think that's a really great resource. Also, on our website is posted the list of locations who receive vaccine each week. Now, I know not every provider is actively scheduling appointments. I think our provider community is really doing yeoman's work here. They're getting inundated with outreach, and that they're doing their best to make sure that people are receiving second doses. They are timing everything appropriately. We do know that you need to wait for 15 minutes to make sure there's no allergic reaction concerns. So I think the provider map is a really great option. I think taking a peek and looking and see who in your community has received vaccine and reaching out through those channels, taking a look at their independent websites. I think this will be a community effort more at the local level, the more vaccine we receive. So I think keep an eye on the map, take a look at the provider lists. And then we're also working on, and it's not quite done yet, and we've started it on the one page on the governor's website, is essentially like a quiz or a tool to help people understand when it is their turn. So that's something we're working on that should be up hopefully in short order. There's just some tech things that I need to understand, that I don't understand, that are being worked on.
Okay, we have 1 minute, so I'll do one last quick question, and then I'm going to let you go because I promised 11:30. Has there been any research regarding allergic reactions in terms of the vaccine?
Yeah, largely it's very safe. So there is exceptional research been done. The FDA did approve did give an emergency use authorization for the vaccines. I can find it and send it to you about the safety and efficacy of the vaccine. There's been very few adverse reactions, but just like with any vaccine, we're being careful and cautious and making sure to monitor people. Personally, I have an egg allergy, so I get a different type of flu shot because that is the risk with flu shots. But when it is my turn, I am also 1C as a public health employee. I will absolutely be getting the vaccine.
And then to the last question, because I'm going to cut it off, I did shoot Megan an email last week offering hotels as potential vaccination sites. And I know Megan sent it over to PEMA. So PRLA kind of has made ourselves available as vaccination sites when you get enough vaccines that you need more vaccination sites. So I think we're all looking forward to that day. And
yeah, we are out. Yeah, we're really looking forward to it. It's coming. I think we're feeling really hopeful. And every person in the community that gets vaccinated is another person who will help keep our health system from being bogged down, will prevent every person from dying. So I know there's a lot of anxiety, and I really just would beg everyone's patience. Our absolute goal here at the department is to ensure that everyone who wants a vaccine will get one. Maybe not this week, but definitely get one. It's, we're not going to stop till everyone is vaccinated. And, I think at some point we'll be looking to your support and to your help, and to have you help us carry the word about safety and efficacy and the importance to your employees and your staff. We know you've been doing really excellent work and have been struggling, and your staff need to absolutely be vaccinated because of the work they do and the connection they have with the public. So I think maybe in a couple weeks, I'll be able to come and ask you guys some questions on how you can help put the word out about vaccines.
That's awesome. Megan, I am going to let you go. Thank you so much for joining us today. And as we get further along, I might ask you to come back to provide some more updates. But with vaccines, we know are important. We're not going to get back to any type of normal until we get the vaccines out there. So thank you so much.
Absolutely. And if you wouldn't mind, just if you're, please follow up with me if you have any questions. I know I need to get you some info on the antigen test. I'm just not quite as good at multitasking as I thought, but I'll work on that before the end of the week.
Totally fine. If you shoot it over to me, we'll put it in our daily update, and then it'll go to all of our members so they have it. So.
Oh, great.
Great.
Cool. Thank you so much, everyone.
All right. Thanks, Megan.
Thank you.
Okay. Let's go back to our normal programming, shall we? Next slide. I think we're starting with federal per usual. One of the reasons you're all here today. Yesterday, the federal government released the Raise the Wage Act. This is not a surprise. I've been warning you about this for about 3 weeks now, but they did drop the bill yesterday. It is as atrocious as we said it would be. So don't be surprised on that front, just as an FYI. On the minimum wage piece, it increases the minimum wage over the course of 5 years, getting to $15 by 2025. That's the proposal in it right now. The other piece of all of this is the elimination of the tipped wage. They're being so generous and making it 2 years slower than the $15 minimum wage. But by 2027, the intent of this legislation is to eliminate the tipped wage completely. So it would increase to $4.95 in 2021. And then it would increase about $2 every year until it matches the federal minimum wage and is completely eliminated. This is the plan that came out yesterday. It is a duplicate of the plan that came out last year. And of course, that's the question you all have right now is timeline, because I know everybody's like, why aren't we blitzing? Why aren't we doing commercials and ramping up? And we are going to be doing all of that. To that end, and I think I mentioned this last week as well, when you introduce a bill, you shoot for the stars, or when you're a new president, you put out every single thing that you possibly want. And I think we've seen that with the executive orders and all of the bills and the proposals that President Biden has put out there. There is not an expectation within Congress at this time that this is a piece of legislation that is going to be considered within the next couple of months. It gives us time to ramp up a response. It also gives us time to be selective in our response. If we blitz right now, and I've talked about this, I love our elected officials. They have very short-term memories. If we blitz right now, and then they bring this up for a vote in May, how many of them are going to really remember the conversation you've had with them and your employees had with them about the tipped wage? It has to be timed appropriately. It has to be timed correctly. And we need to be using every resource that we can. And this is going to be one of our federal priorities. In the interim, our focus is getting another COVID relief package done. We do not expect, as I mentioned, Raise the Wage to be included within that relief package, but it is something that's going to come up in the future. So when the time comes, we're going to provide you every resource you need. If you are regularly in conversations with your congressional delegation, with Senator Casey especially, Senator Toomey, please start raising these concerns. But this isn't timing wise. It's not that we aren't doing anything, it's that we have to go about it appropriately. And to that end, I want to flag a date for all of you, because this is something that I expect all of you to be involved in, is the National Restaurant Association every year has their public affairs conference. It's when everybody goes to DC. We schedule meetings with your congressional delegation. We talk about our legislative priorities. Guess what our top legislative priority is going to be? But they have converted this to virtual for this year. So the conference is going to be April 20th to the 21st. Actually, April 20th kind of to the 22nd in terms of scheduling meetings. It's entirely virtual. We will be, for those of you who have participated in the past, we schedule meetings with our delegation. They're all going to be on Zoom. They're all going to be virtual. You don't need to travel anywhere, but we're really going to need high turnout for this. So we'll have more information in a couple of weeks, but mark your calendars. If you are a member, it's going to be $50 for the 3 days. If you're not a member, $75. There's amazing programming. It's an amazing experience. And typically we have trouble getting people there because DC isn't that cheap and it's expensive, but this is actually a really great opportunity for everybody to get involved. And I can tell you that's going to be our hard hitting pushback on $15 minimum wage and elimination of the tipped wage. So please mark your calendars, April 20th to the 22nd, and look for more details on that front. Next slide. Well, first, for state priorities, I want to say a huge thank you to John Longstreet, Chris Sirianni, and Jen Furtenbaugh, who testified before the House Commerce Committee this morning about the impact COVID has had on the restaurant industry. It was actually one of the first meetings that we've had that was an actual committee that had Republicans and Democrats. And I think universally, outside of one little comment, really kind of showed the impact of the industry. And John and Chris and Jen did a phenomenal job advocating and talking about the impact COVID has had. I know John's already received a few phone calls since then. I know I've received a few text messages. So it's definitely helping us lay the groundwork for our legislative priorities. To that end, things are happening. And that's good because I was a little worried things wouldn't happen as quickly as I wanted things to happen. I have to return probably about 6 calls after this, but it sounds like the House Liquor Control Committee is ramping up to move a good number of our liquor priorities on our recovery list, which you've all seen and you probably have memorized right now. The items that it looks like they're looking to consider very shortly is eliminating safekeeping fees until January of 2023. So if you purchased a license or put your license in safekeeping, or you purchased and are planning to build, technically you can get charged tens of thousands of dollars for not using the license. Well, who has the capital to build a restaurant or renovate a restaurant right now? So it would eliminate safekeeping fees until 2023. The one that everyone's going to be a little bit more excited about is they're looking to move a bill that will increase the licensee discount with the LCB from 10% to 15% permanently. This has been a PRLA priority for a long period of time right now. So they're looking to move that bill. They're also looking to move legislation for my caterers, eliminating the fees for the off-premise catering permit for 2 years. So you won't have to pay that $500. I know many of you paid $500 in 2020 and your licenses just kind of sat there. We're looking to eliminate those fees. Another piece allowing, this is going to help a lot of you come spring, because as we're hearing, we won't have enough vaccines come spring. Will allow you to extend your license to a non-contiguous area. So if there is a parking lot across the street, or if you go around the corner and there's a sidewalk there that you can use, but there's a tiny shop in between, technically you can't expand your outdoor seating there. This would allow you to expand your outdoor seating so you can get more creative with more seating in that space when the weather gets warmer. And then something we don't like to think about is if a licensee closes permanently, legislation that would allow you to sell off your product if that's a decision that you're forced to make because of the crisis. So those are some of the items they're looking to move potentially as quickly as next week. So we're definitely seeing a response from the legislature. I know we ended 2020 frustrated. I did, still frustrated, but we're definitely seeing the response from the legislature in terms of recognizing that maybe they didn't do enough when they could have for the industry. So we're going to continue to push on all of that. The news that we got yesterday is that 145 million hospitality grant. And I printed it out. So I'm going to try and tell you what I know. This was a move by the Senate. It actually was kind of 900 million-ish, I think, by the end of the day between the three things that they did. But part of it was dedicating 145 million to the hospitality industry. This was an amendment that was put into a bill yesterday. It passed unanimously in the Senate Appropriations Committee. The Senate is expected to pass it finally today and send it over to the House. So this could be a bill that could get to the governor literally as early as Wednesday of next week. And it does include that 145 million. It is specific to hotels and restaurants. For my nonprofits, it is only for for-profit entities. And don't get mad, but 145 million only goes so far. So this package, which we are calling, I've been saying down payment a lot of little down payments, it feels like, we feel is the first step. As we said before, we think we need $1 billion to get out of this. So this, we're 10.5% there. So, you know, moving like gangbusters. But this is going to be specifically for restaurants and hotels. It's going to take the 145, give it to counties based on population. Grants will be between $5,000 and $50,000. This is all going to be based on the counties. There's going to be preference given. So basically, it's not going to be first come, first serve in terms of grants. They're going to be kind of weighted. Of those who need it more are going to be eligible before others that might not need it as much. And this is a key thing for many of you, you are not disqualified to apply for this grant if you received CARES dollars or P3. That's been an issue we've seen before, is if you've gotten any other funds, you're not qualified. That's not an issue here. Now, you might not get first crack if you've received other grants and other CARES dollars, but it doesn't forbid you from applying. Those that have lost 50% in sales from 2020 to now, over the course of 2020 compared to 2019, 50% loss is going to get first crack. Businesses that are shut down completely, my restaurants, they are going to get first crack in this. So they're going to be weighted and likely get the first round of funding from this. To be eligible, you only need to prove 25% loss. So anybody who has 25% loss is eligible. 50% is going to get the funds first. These funds are going to be rolling out as soon. The funds actually should be getting out to your counties by March 15th if this moves efficiently. So you should start getting some of these funds within the next couple of months. Some things that I've been getting, and this is kind of key in terms of the timing of this, it includes hotels, and hotels really have not been included in a lot of these grant programs. So this does, like I said, specifically include them. Generally, if you have these are NAICS codes, 721 and 722 are the two codes that are eligible for this grant. So if you are 721 or 722, you check the first box. You have to have less than 500 full-time employees across your entire business. So if you're a franchisee and you have 30 locations and you have 1,000 employees, you would not be eligible. So it's 500 employees is the cap to be eligible. And your tangible net worth has to be not more than 15 million. So that's a significantly higher standard than what we've seen before. So that's kind of the basics of where we are. We are optimistic that this will get to the governor and that he will sign it. The fact that it came out unanimously is a really good sign, but we need to get through the House. The House is a typically more conservative body, and a lot of these funds are relying on more federal funds coming down to pay it back. So it's something that we're definitely keeping an eye on. As we said, it's a good first step. Thank you for all of you. I don't think we would have seen a movement this quickly and without all of you kind of drawing attention to the lack of assistance the hospitality industry has gotten. And huge thanks to Senator Pat Stefano, who championed this for us and got this across the finish line. So huge thanks to him on that front. So that's what I know. about the 145 million right now. Stay tuned. Like I said, it could change as it moves through the legislative process. And it also, there could be some more negotiations or regs that come out, once this gets passed finally. Unemployment compensation, just a few updates on this front. The extra $300 should be, I say should because it's Pennsylvania and our unemployment compensation system is less than desirable. Your employees should be receiving that extra $300, and it is backdated to, I think, this last week of December, second to last week of December. So it is backdated. Your employees should be receiving that extra $300 a week. And of course, we're looking at the federal level, potentially extending that again. I think they're looking at an extra $400 a week. So we'll keep an eye on that. A question I've been getting, and if you're a nerd and just memorized all of PRLA's priorities, you're probably aware of this, but not everybody's a nerd. Pennsylvania, during the COVID crisis, passed legislation that was relief from charges for employers as it pertains to unemployment. Because you were forced to lay off your employees, you should not be punished and have an increase in charges because of layoffs that, quite frankly, you wouldn't have done if it wasn't for COVID. That covered 2020. That's why right now you didn't see an increase, now that we're in 21, an increase in your charges in terms of your unemployment compensation payments. That ended December 31st. So unless we pass legislation that provides relief from charges for 2021 or 9 months of 2021 or whatever we can get done, your employees that are on unemployment right now, that's going to trigger an increase in your charges once we hit January of 2022, because it hits the year after. So we are, one of our legislative priorities, we should, last year it was kind of filled in with federal assistance. So we're hoping with federal assistance, we'll be able to extend it. But that is an issue that we have right now. It's something the legislature has voiced that they would like to deal with. And we're certainly hopeful that they will, because right now our industry has more people laid off than anyone, again, through no fault of our own. So that's where we are on the state level. Philadelphia. PRLA sent a document of dreams over to Philadelphia yesterday and today. We're working with them on how we can get restaurants back to 50% within the city. There's definitely, I think, an acknowledgement within the city that they want to work with us and find a way to get there. I think we're differing on how we get there. They gave to us last week some ventilation standards that they believe restaurants need to meet to get to 50%. We think a lot of those ventilation standards come at an extra cost. So we're working through all of that with the city of Philadelphia. So we will not have an announcement this week from the city regarding an increase to 50%. We have another call with them on Friday, and we're certainly hopeful that we'll make some progress. And Dr. Farley will feel more comfortable making that announcement. The case counts going down is helping us. But as Megan said before, these variants are really causing a lot of concern, and people don't want to move too quickly until they can figure out if the vaccines will protect against the variants and how bad the variants are right now. So that's where Philadelphia is. Philadelphia returns to session tomorrow. So we'll be working through, tomorrow, working through a number of pieces of legislation there. Allegheny County, beginning today, is going to begin the process on passing paid sick leave. It's not, again, a right now thing. It's going to take time to pass the legislation. They need to coordinate with the Department of Health. But for my friends that are in Allegheny County, but not the city of Pittsburgh, you already have mandated paid sick leave. If you're in the county outside of the city of Pittsburgh, this is a piece of legislation you're going to want to get comfortable with when we get more details. It sounds like it will be duplicative of what is in the city. So it's not going to be changes for anybody that might have more than one location within that county. We expect the legislation to pass. We're working in ensuring that it will not take effect until we're through COVID. Obviously, any type of mandate on our businesses in Allegheny County or anywhere in the state is not good or a good idea right now. So we're going to be working through all of that. Next slide. It's funny, Megan spoke for 30 minutes and I feel like I'm just cramming all this information in the last like 30 minutes. Case counts, Megan mentioned this as well. They're going down. It's just the irony of like how this started. Remember when it would be over 1,000 cases a day and I would flinch, and all of you that were asking me if we were going to get shut down again, I said, I don't know. I'm really nervous. It's over 1,000. And then we hit a peak of over 12,000, and now we're at 4,000. And I'm like, cases are down. We're winning. We're about 4,000 cases a day right now. So they are going down. There was not kind of the massive peak that I think we saw from Christmas or from Thanksgiving. I mean, I think though we're all hearing and seeing now more than ever friends and family who are contracting COVID and dealing with COVID. So it's definitely more prevalent than it ever was before. But to Megan's point, and like I said, the hearing this morning, John, Chris, and Jen did a really good job of saying our industry can operate safely, and everyone's going to be hurt long term if you don't let us return to some type of normalcy. And I think we've proved that we've done everything we needed to do. We need to keep on moving forward. So we're continuing to lay the groundwork there, and we're certainly hopeful, especially for my hotels, my weddings, my caterers. Restaurants have been hit hard, but we recognize that you have been hit harder, and we're certainly working on increasing that 10%. So you can start having those events again safely, as opposed to all of the backyard weddings that are going on all across the state right now. And I think I can stop talking for a few minutes before I take questions.
Yes, we definitely can. We will be having a webinar tomorrow with the small business. We'll be talking about an update on IDLs, the PPP 1 and 2 drawdowns, the shutter venue grants. It'll be a 35-minute webinar tomorrow at 3 p.m. with a Q&A session. So please join us tomorrow. He did present, Solomon did present at our Southern chapter, and we brought him back on a state level because we thought it was important. I know a lot of you have IDL questions. So please check that out tomorrow. Again, we'll be back with Melissa next week. And then the following week, we are going to be bringing the tax accountant on to help out with divvying up the talking for Melissa. So if you have any questions on that, please check that out on the 10th. Tomorrow, the NRA will be having a half-day event. It's IT-based topics, but it's panelists that will be talking about pivoting to offsite, the state of the restaurant industry's future, and technology that can help with the pivots that everybody's been making. So if you have some time, please check that out. It is free. And then on the 11th, the NRA will be having some attorneys that will be talking about exploring the legal and practical issues for the restaurant industry and vaccinations. We'll be talking about mandations or refusals from your staff, workers' comp implications, and the policies you should be thinking about if you are going to be talking to your staff about vaccinations. So please be sure to check that out. Just as always, make sure that you're out on carryout PA so that everybody knows what you're offering from your establishment, your hours, takeout, delivery, indoor dining. And for HARP, we had a really great event yesterday with a live Facebook chef event. We've raised over $400,000 for this fund, and we're continuing to spread the word. And if your customers are looking for other ways besides dining in your restaurant and getting takeout and delivery, please suggest to them to support the frontline workers through HARP so that we can open up the application again to help these workers. And as always, just keep an eye out on our training schedule. Our classes are filling up because of the restrictions with COVID. We do max out at 10 to 15 students with classes. So please be sure if your employees need to train to get into these programs. And if they are looking more for a remote proctoring or ways that they just would train at home, they can do that through servesafe.com. And with that, I'm going to turn it back over to you, Melissa. I don't know if there's a ton of questions.
We'll go through a few follow-ups to Hope, because I can't avoid extra commentary. If you haven't looked at the video of Just a Taste from last night, it was so well done. It just absolutely phenomenal. So please take a look. The chefs were amazing. The feedback was amazing. If any of you did a video for it, I have ADD sometimes when I watch kind of live streams, and this was just amazing. So please Take a moment to watch if you can. I think it tells a great story. Also, as a follow-up for the SBA webinar tomorrow, many of you participated in our P3 webinar with the Bankers Association a few weeks ago, and you had a lot of EIDL questions, and we couldn't really get into them because EIDL goes through the SBA, not through your local bank. So if you have those questions, that webinar tomorrow is going to be your spot to get the actual answers that the bankers were not able to, just because that's not within their purview. A few questions I've gotten about tips. I think it's a little bit more commentary. John did put into the chat how the tip wage increase is going to happen. I mean, I'm a terrible betting person, but I'll take a bet. So I don't think tipped wage is going to be eliminated completely. I think we already are hearing from some moderates that they're not comfortable doing it. And quite frankly, it's not kind of a national thing right now that people want to do it. To that end, it's going to be your interaction with our elected officials that's going to get them to kind of pump the brakes and say, we can't do this. But in places, where we're seeing this happen is some restaurants go to a no tipping model. And that's something that they do. Others, as opposed to, in addition, usually to increasing prices, put on a service fee that they use to try and make up the wages. So if this passes, it changes the entire way our industry looks. And I think our industry is going through a ton of change right now. And I don't think that this is something to pile on top of all the other changes that we're looking at. And that also came out from the event last night at Just a Taste, where we all need to kind of think about the future and know that how we operated in 2019 isn't going to be how we operate in 2021. So it's going to be your interaction with your elected officials and our elected officials that's going to determine if tipped wage is eliminated. It's really going to be our efforts. Restaurant industry, I mean, so are salons, but more than any other, we are the industry of tipping. So it's going to be up to us to do something about it. I got a question about 25%, that's the loss, a reduction in revenue is the trigger for that, and that's for the 145 million. So 50% loss of revenue gets first crack, 25% is what you need to prove. So it's loss of revenue in the bill. I think I answered the question of who's eligible. The 721 and 722 are the two NCAIS codes that are eligible for this 145 million. And to that end, we're not done with this. And even the legislature and the Senate said yesterday, they know it's not enough, but it's a step. And everything, as we're learning through all of this, is a step. And some steps take longer than others. When does the current $300 unemployment compensation kicker end? 13 weeks. It was extended 13 weeks. So from whatever, I want to say December 23rd-ish, I think is when it started, and it goes for an extra 13 weeks. And then there is, I think, another extension included in the Biden administration's recovery plan. Does the state seem to be more open to working with PRLA and other groups to help guide changes to restrictions? John, do you want to try that one, or you want me to take a crack at it?
It depends on what you mean by state. If you mean administration, I would say no. And they never have worked with other groups, at least according to what's been reported to us. And they were working with us up until July 15th, but I don't think there's really any difference now. The legislature is falling all over themselves about how they need to help the restaurant industry right now. As Melissa's already, restaurant and hotel industry, the hospitality industry, as Melissa's already said, but I don't think there's really any difference in the new year.
Yeah, and I think we mentioned this before. I mean, we're seeing, I think that there's a different mentality within the legislature there's a mentality in March and April where I think we all were saying, okay, we need to shut down. We don't know what we're dealing with. We need to figure it out. And then in June, July, August, September, case counts were like 500 a day. And we were ready to reopen in some places, not others. And I think the legislature is getting frustrated. And I think, to John's point, they're feeling it. They're putting pressure on the governor. They're saying, we can't continue to be at a disadvantage to other states. Other states are opening up more. And I think, as we see case counts continue to go down, there's going to be that pressure and desire to make those changes. So I have a question. Is there a P3 guidance FAQ or something somewhere? I don't know if somebody's loaded up the thing from the NRA yet. Example, I know the rules 3.5 times of payroll and 25% loss for a quarter last year versus this year. I opened one restaurant mid-November 2019, so I don't have a quarter in the books other than 2020. There is an answer to this. So here we go. So for a new entity that did not exist during the 1 year period before February 15th, 2020, but was in operation on February 15th, 2020, its loan amount can be calculated by multiplying the below figure by 3.5. And I'm sure Ben or Steph or someone's going to load this in the box. The sum total of monthly payments made by the borrower to cover payroll costs, and dividing that sum by the number of months in which those payroll costs were paid. So you would take, if you were in operation for 8 months, you would take your total divided by 8, and that's the sum that you're going to use to determine your 3.5. So you are eligible, as long as you are in business by February 15th of 2020, you're eligible for this P3. To that end, we have heard from a few people that, God bless them, and bless their hearts, opened up in like August of 2020. And as of right now, they are not eligible. And we're hoping that with this next recovery bill, those that did open in the middle of the crisis and are trying to get through it will be eligible, because technically right now they are not eligible. Would the hospitality fund go through local banks or CDFIs, or so if they, or something like the URA in Pittsburgh? So it would go through the CDFIs. Is how, and this, I think we're back to the 45 million that we were discussing. So that is going to go through your community development corporations. I always forget their official word, but that is what they're going to go through once I get to the, yeah. So it's going to go through your community organizations, not through the banks. The banks do P3s. It's going to be your local community development corporations that are going to fund this. Is there a deadline to file an initial UC claim to qualify for the federal $300 a week? There's not. In terms of, as long as you're doing it, I mean, there's not a deadline to file. Maybe I don't understand the question. So if you were at any point in time, you're eligible. It's 13 weeks of an extra supplement. So if you filed, you can even backdate it. I know some people had been taking unemployment compensation. They probably got a jumbo payment of kind of $900, but there's not a deadline. It's just when you go on unemployment, you can file for it. Ben included the NAICS codes. So questions about CDFIs, outsource the first 25 to Lending Tree. Lending Tree is very black box, closed operation with zero communication. We applied and had 3 of the 4 preference criteria and received nothing, no communication. We can reach out, and this is kind of the problem that you have with government, is they like to outsource. So we can look into this. I know there were some places didn't use Lending Tree. Some places, and I forget what they used someone else, and it worked out very well. But we can definitely revisit that and make sure this is an issue. Maybe Dana, after you and Molly chat, you can let me know. We can try and revisit that and draw some attention to some of these programs if they're not working properly. And I think I will say in 2 weeks from today, on February 10th, we will be having an accountant as our guest to really go through kind of the taxable and non-taxable items as it pertains to the federal funds or state funds that you may have received. So that should answer a lot more of kind of those accounting questions that don't ask me because I hate numbers, which John is well aware. So with that, I think we made it. Thanks for hanging on an extra 5 minutes with me today, guys.
Thank you, Melissa.
Everybody. And as always, we have this recorded. We will send it out, and we'll be sure to get those links that you were looking for into the daily update today. And with that, everybody stay safe and have a good rest of the week.